Hi there. Nice to see you. Can we start with, can you tell us a bit about who you are?
Hi, I'm Pascale Allotey, the director with the United Nations University International Institute for Global Health.
I guess I wanted to start, if you wouldn't mind, by saying something about how COVID has affected you and your family personally.
On a personal level, it is real. It is really real. And in some ways, even the professional has a personal element to it. So I guess in the first instance, what I talk about is that I do have at least one member of staff who has lost her parent to COVID. We are based in Malaysia, and with the travel restrictions, it's been really hard and really tough, trying to support her, knowing that she's unable to return to her family. On a more personal level, we have had a death in the family as well. My father-in-law, not to COVID, but the problem of, again, with the travel restrictions. So it's been incredibly difficult for my husband in particular to be able to join his family. With travel, it would have taken at least 6 weeks with multiple transit points and quarantine in each of those transit points to get home. So it's been really tough on the family, on him and on my kids. So I actually left Malaysia two weeks ago to join them. I'm on my own in Malaysia and literally in solitary confinement and had been for a good seven weeks. I think the thing that was interesting about that was a real sense, hating it and getting used to just the claustrophobia of being in an apartment on my own with no human contact at all. Now, having said all of that, as a human being, just kind of getting to understand and seeing what it means for other people, any problems that I have are just a total privilege compared to most of the population. And I think one of the most confronting scenes for me was watching, I think it was a YouTube or something, when the restrictions were eased for the first time in Malaysia. There was this really amazing news clip that was shown that had people queuing for blocks. And it kind of panned from the end of the queue all the way forward. And they were all waiting to get to a pawn shop to be able to sell something of theirs, to have access to some money, to be able to, get food, really basic stuff. And it is, I mean, it is a pretty amazing time in our lives.
You have a bird's eye view of so many policies that are happening kind of around the world and sort of what's happening. Are there areas of focus or policies that you consider that most of concern, that are things that you've seen that have come to light because of COVID?
It's always easy to criticize in hindsight. And I think this is a crisis that is totally unprecedented. I don't know that I guess there are lessons that we could have learned from the history of previous pandemics and so on. But I don't think any of us knows the right answer. And I think whatever the intervention is or could have been, there would be collateral damage somewhere. I think if there are major regrets or bits that we actually have to learn from, it is really looking at what the longer term social impact of this has been, and perhaps thinking a little bit better about how we rescue in terms of newer policies or building on where we are now, is just being able to take that step back and think about health as being more than just the management of the disease, and actually being able to do a little bit more thinking around the various trade-offs that we could have made or that can be made into the future, that acknowledge that point exactly, that we are a society, that we do, there are a whole range of social determinants. I mean, more than me, you would have been exposed to all the demonstrations in the US that have to deal with race issues that are much more than just race issues, but a whole intersectionality of a whole range of other social determinants as well that are playing up together with the fact that people have been on lockdown and all of that. So it is an incredibly complex area. What I would really like to see is for us to be able to take the time to think about how it is we work and engage with this level of complexity much more than we have done before. I think that would be the most critical thing.
Mm-hmm. I totally hear you. I mean, and that leads me really to my last question, really, which is, just thinking about us as a society, what do you think we should take out of what we've learned through this experience during this pandemic? What are some of the lessons that you see that we should be keeping in mind as we move forward?
There are clear opportunities for engaging better with communities. I think given the severe measures that were taken, the science of so whether it's the social science, whether it's political science, whether it's the anthropology, whether it's around the recognizing our humanity, all of those sorts of things, and bringing that knowledge together. I think there is a real opportunity for us to. It's kind of almost a bit of a cliche now, but the kind of the notion of building back better. But I think relationships have been formed, even if they had to break. Whether it's through the racial demonstrations and so on, they had to be broken for them to be mended. There have been some really enriching stories of communities coming together. If only we can hold on to that and collectively privilege the knowledge that is and the lessons that can be picked up on the basis of communities doing things for themselves, and for governments to listen better. I think that those are some of the real opportunities that we have now.
Thank you for that. I'm really grateful that you took the time and for those incredible insights. So thanks very much.
My absolute pleasure. Thank you.